All right. Hello and welcome everyone in Facebook land and everyone on the call. My name is Jenny Beaver and I'm the CEO of Fourth Trimester Arizona, a grassroots 501c3 collaborative of parents, families, health professionals, educators, and local organizations. We are on a mission to change the culture of parenting so no one has to do it alone. A big, long mission. Thank you for joining us today for our 6th Lunchtime Ecosystem Conversation. The pandemic has been disruptive on many fronts, and child development has been a major concern for many of us in the maternal and child health space, as well as for parents, which many of us are those too. Researchers around the world have really just begun to look at how things like increases in perinatal depression, media use, food insecurity, and elevated stress may have impacted children, as well as some of the resilience factors that we know exist. So as supporters of expectant and new parents, today we invite you to collectively explore how COVID-19 has impacted child development for our Arizona families. I'm going to advance the slide, please. Next one. Good job. Thank you. All right. For those of you who may be less familiar with Fourth Trimester Arizona, I'll begin with a brief introduction of our organization. We connect maternal and child healthcare providers, social support systems, and parent support groups to foster collaboration, education, and to increase access to local resources. Our programming includes 3 main focus areas: our monthly village meetups for new parents, our annual 4th trimester conference for both parents and professionals, and lastly, today's focus area, our newly developing 4th trimester ecosystem initiative for all who care for pregnant people, new mothers, and their babies. The goal of the 4th trimester ecosystem is to facilitate inclusive conversations about what is working and what needs to change to better support new families in Arizona. Next slide, please. For today, we expect our time together to flow something like this. Our intention is to spend the majority of our time listening to our 3 speakers' experiences and then discuss what we heard in smaller breakout rooms. Next slide. Before we get started, let's review just a few key items to ensure everyone is able to fully participate. During the presentations, please post all comments and questions in the chat box. We will be monitoring the chat and responding to your comments and questions. We also ask that you please remain muted except for when you're in the breakout rooms. Of course, then please unmute and join the discussion. And next, we request that you please enable your video if you're able, especially during breakout sessions. Of course, if you run into bandwidth issues, please turn off your camera. And lastly, we're recording this session so we can send it to you and anyone else who registered later. All right, next slide, please. Now on to the part we've all been waiting for. Today, we're focusing on the impact of COVID-19 on child development. And we'll hear from 3 perspectives in the following order. Jessica Perfett, a mother who has had a small child during COVID and actually has more than 1 small child. Sarah Saksek, a nurse home visitor, and Anna Arbel, the program director for the Birth to 5 Helpline with Southwest Human Development. We thank each of you for being willing to share your experiences today. For everyone listening, it's helpful to consider that we all come from different maternal and child health focuses, and yet we're all interconnected through the perinatal period and beyond. Our first speaker is Jessica Perfett. Thanks for being here, Jessica. Jessica is a mother of 2 little boys, 15 months and almost 3 years old, and is a program manager with the Arizona Department of Health Services and responsible for oversight of the Child Fatality Review Program. Jessica graduated with her master's degree in public health from Grand Canyon University and has over 8 years experience working in the public health sector. Jessica supervises and oversees the Child Fatality Review Program, which reviews all child deaths that occur in Arizona to determine trends, preventability, and develop prevention recommendations to protect the future of all Arizona children birth to 17 years of age. Go ahead and unmute yourself, Jessica, and share your experience with us, please.
Yeah, hi, thank you for the introduction, Jenny. Like she said, my name is Jessica. I'm a mom of 2 little boys. One's 15 months old and one is almost 3. Sunday will be his birthday. So really almost 3 years old. But I just wanted to talk just a little bit about my perspective on the pandemic, having a baby pre-pandemic and then having one smack in the middle of the pandemic, kind of how that effect is, what it was on both my older, almost 3-year-old, and then on the newborn. So in November of 2019, kind of when the pandemic the news wasn't quite out yet, is when I was pregnant. And then obviously in March 2020 is when it really hit and everything started locking down. And I was about 4.5 months pregnant at the time, which was pretty scary, not knowing what we know now looking back, like what it was going to cause with pregnancy or with infants, the newborn, like what the outcome was going to be or how it was going to impact us. It was just a really scary time. But the nice thing is with my work, I was able to switch to remote working in March of 2020. And I've remained that way ever since, which is really nice in the family dynamic that I can be home with my kids every day. But then on the flip side, I'm home with my kids every day. But just the effect that it had on, so Cruz is my almost 3-year-old, and then Luke is my 15-month-old. His birthday was in August of 2020. So I think what's interesting, and I wanted to point out just kind of my experience with it, is when I had my oldest Cruz, like he was really, he interacted with a lot of people, a lot of caregivers, like other people would watch him during the day while I went to work physically. And then he also would go to childcare. He would be seen with people in our church and we'd leave him with them. So he really had a lot of different adults in his life that would watch him and give him instruction and guidance and just be involved in his life. And then when Luke came along, obviously there wasn't really interaction. Like nobody saw him, nobody helped take care of him. He didn't go to any daycare. No one else watched him besides, my husband and I, and sometimes my mom. But just as interesting to see the two differences, because my oldest is very, he's likable to a lot of people. He has really good social interactions. And then my 15-month-old, I can tell he's very like, I don't want to say like scared of adults, but it's different. He has like kind of like a social anxiety, if you want to call it. Like if I try to hand him to anybody, he just like holds tight and grips onto me and just like he's very uncomfortable not being around me because that's all he knows. His whole life is this last little over a year of his life is being home with his mom all the time. Like there hasn't been a handoff of him to anybody, which is just interesting to see the difference between the two. But I just think that social connectedness is really important for children, and it's just not something I was able to provide for my second born, just with the pandemic hitting. But now my oldest is going to like a preschool, a daycare, a couple days a week. And the first couple months that we started dropping him off over the summer, like he started acting just very shy, and he would cry almost every single time that we dropped him off. Like he didn't want to be without his mom or his dad, whether either one of us dropped us off. He would cry and just had a really hard struggle. And he's still struggling with that now, but I can tell it's starting to get a little bit easier. Like this morning, for example, it was like probably one of the first times he hasn't cried in the last few months when I dropped him off, like running after me when I'm trying to, run out the daycare without him. So just really different, like noticing through this whole pandemic, kind of like, social anxiety or like separation issues that weren't really there before. Another thing I thought was interesting too is obviously throughout the pandemic, everybody was wearing face masks, which, at first, it's kind of weird to look at, but I noticed with my infant, he's only seen people, wearing face masks when we went out shopping, whether we went to, a retail store, or whatever we happened to go to. If we had to go somewhere during the pandemic, everyone had a mask on. So for him, like not seeing facial expressions was very normal to him. Because I noticed when, we started not wearing masks as much, or people around him, like talking with their facial expressions or their lips, he would just stare at your lips when you talk, almost as if it was kind of weird to see, which I thought was interesting. Just like he grew up his whole life knowing, only like the eyes of somebody, not really seeing the facial expressions that we give without having half of our face covered. But I thought that was interesting. Another thing too that was an impact was with our pediatrician, with well child and sick child visits. So with our well child visits, we were limited to only having one caregiver go in, and usually my husband and I always go together. And every time we went into the doctor, whether it was for a normal checkup or a sick visit, mainly just our well child checkups, if we went in, he always was treated like they were infected or contagious or something. Like everybody was wearing masks, like there was no hugs or how are you doing or like getting close or any kind of like physical touch that you would normally get when you would go to your pediatrician, besides what was like absolutely necessary if they had to check, like push on his tummy or something. Like that was it. But I wasn't used to that with Cruz, who would give his doctor a hug, we'd have conversations, and the touching would happen. So that was definitely missing with well child visits. And then the other thing was with Cruz being a little bit older, he didn't really have any in-person well visits unless he like needed a vaccine or a treatment or something that physically had to be done in person. They switched everything to virtual. So even if he had an ear infection, like normally you'd bring them in, they would look in the ear, see if there's an ear infection or not, and then, do whatever was necessary. But that didn't happen with him. They would just do a virtual visit. And whether he, really had an ear infection or not, I didn't know, but they would just give him, an antibiotic or something to help with treatment. So it was very interesting to see how the older one wasn't seen hands-on as much as the newborn was. But then as Luke started getting a little bit older, like older than 6 months, he wasn't seen as much either. And then with sick visits, I thought it was interesting too. No matter what we went into the office for, he was like tested for COVID for anything, whether he had like a runny nose or he had an ear infection. I know there was this one experience I had where he had a fever that was just like coming and going for like 5 weeks. It would come, and then a couple days later it would come again. Like it was in waves, which was weird. But like at one point during the 5th week, it kept hitting like 104, 105 degrees, like a point where it was concerning to be that high of spiking. So we brought him in, they saw him, they tested him for COVID for like the 17th time, like it just coming back negative. And then it turned out he had a body rash like 2 or 3 days later, and it turned out to be roseola, which is, infectious for other kids to get, sometimes adult, but there's nothing you have to do in terms of treatment. You just kind of wait it out, which was like a relief. But then again, like he had gone through so much testing because of the pandemic that really wasn't necessary. So it's just kind of interesting switching to, remote televisits compared to hands-on, and then just everything was assumed to be COVID, even if it wasn't. And then just one other thing I wanted to talk about was just like the effect with life events that COVID had with Cruz and Luke. And obviously it's too soon now to know what the long-term effect of this is going to be, but I can just tell from the short amount of time, like what the impact has been so far, like life events that have happened with Luke being born in August of 2020. Like normally with our oldest, like we had a meal train and we had our friends come over and would meet him, and all the family would come over and sometimes never leave because they wanted to be with the new baby. And just the interaction was really there. With Cruz and with Luke, it was like crickets, like a ghost town. I think we had one friend come over and meet him, like extended family. None of them met Luke for a long time. Like everybody was just holed up and not coming out of their bubble, understandably. But it's just interesting with Luke to see how he didn't get like that experience, his first couple months of life of meeting people and being held by other people and comforted by other people. Like none of that had happened. Like missed life events. Like I know grandparents missed Cruz's little birthday party that he had, and just the family interactions were really limited. So I'm not sure long term what those effects are going to be, but I know it just like the immediate impact that it had on my kids, I can tell it's just been a little bit different between the two, having a pre-pandemic and then a pandemic baby.
Yeah, absolutely. Wow. Yeah. The whole, your kid never doing really in-person doctor's visits, that I didn't even think about that, but yeah, that makes total sense. Wow. Thank you so much for sharing, Jessica. That was really interesting. And yeah, and I'm so glad that we got your perspective about what it was like with a brand new little one during the pandemic versus what it was like pre-pandemic. And yeah, I mean, you really got 2 little ones under 5. So that's very, very relevant. And also, yeah, 2 kiddos that are going to be, potentially impacted, positive, negative, who knows? But yeah, thank you for sharing so much. We really appreciate that. Awesome. All right, now we will move on to hear the experiences of Sarah Soksek. Sarah has been a nurse serving pediatric populations for over 20 years. Most of her experience is within the hospital environment, particularly in the NICU. She has more recently become a member of the Nurse Family Partnership Team. NFP serves first-time moms and their families in ways that foster personal, emotional, and financial growth, which impacts future generations in a positive way. She helps empower women in the Tucson community to live up to their greatest potential. Sarah has 3 children, a 16-year-old daughter and 11-year-old twin boys. Sarah and her family enjoy hiking, camping, and traveling when they aren't caring for their pets at home, which include 3 tiny bantam chickens. Sarah, welcome, and please go ahead and unmute yourself and share your experiences.
Thank you, Jenny, for that. And it was great to hear from you, Jessica, because I felt a lot of what you were saying, just in my experiences. My children are older, but just in the hospital even. So again, my name is Sarah, and I've worked primarily in the intensive care unit for newborns and more recently with Nurse Family Partnership. So the way that I've seen it impacting child development, number one is in the ICU setting. We have to wear masks, obviously 12-hour shifts. The infants never see a human expression, and they don't even see their parents' expressions. And so when you have babies that are there for months and have never seen an unmasked face, I worry, deeply worry about their emotional development and how they're learning to trust their caregivers, their parents. I will see a parent often, like sneak the mask down, but it's almost like they just feel guilty. They're sneaking the mask down. They're not sick. They don't have symptoms, but they will sneak it and look around. And so I worry about the baby and what their, brain is processing at that point in time when they're there for, I had a baby there over a year that had never seen a human wear the mask covered. So that worries me a lot. So based on my experience, I think it's essential that practitioners, especially in the hospital setting, kind of realize what these families are going through. I think it's easy to just try to get through your day and try to work through it, but to realize these are people, these are brand new moms with their first babies, fifth babies. I had a patient the other day whose mom had COVID and she had never met her child, and the baby was 2 weeks old. And so, it's just impacted those brand new babies and families immensely. They need to bond with their family. Nobody's holding them because the nurses, we do what we can, but we don't have time to do it. So no in-person support. I think I might transition from not only the hospital setting, but in my other personal life and work at Nurse Family Partnership. Not having that in-person support is huge, especially for my families that are struggling to breastfeed, for example. I can offer so much to them, but I'm not allowed to see them in person. So I've had to just kind of troubleshoot over the phone and refer out to other programs and to sit and feel like I could help, and not be able to. So just feeling powerless, not able to do the in-person stuff with those families. And so some challenges that have come up because of the pandemic are that have been exacerbated. I have several clients with anxiety and depression already. And so one of them has, I think her son's 4 months, she's never even left the house. And sometimes I feel like that can be just as bad as COVID, being so incredibly isolated and scared that you won't even go on a walk through your neighborhood because that's where she's at. So I think if you already kind of have that going on and you're isolated, makes it really hard to feel safe. And then new challenges that this has brought on for me is just connecting with that client on that not personal level, but one-to-one, like we're over the computer screen instead of being in person, and maybe even giving a hug. Like I cannot wait to give my client a hug someday. And that's so sad to me to be like, I can't wait to hug you or just, tell you you're doing a great job in person. So, but that's like a silver lining for me about COVID. If you could find one, it's like you take that for granted until now. It's like, oh, I can't wait to see you in person. Yay, soon, and before it might've been like, so what, we're in person, big deal. So just the excitement of that. And then in my personal life, I've seen, for me personally, I've had to move my children's schools. They had to go from public school to, not a private school, but a charter school where they allow in person, because I personally am the only parent in my household. I can't do online. I can't do virtual school. It's not possible. So I would have had to, quit my job and maybe move in a 1-bedroom apartment and educate my children, because I can't do it. So that's how it's impacted me personally. They would have fallen very far behind in school if they were home doing virtual, because they don't do virtual very well. So it's been a challenge, that's for sure. But I don't know. That's pretty much it. Just my biggest concern is for infant development, birth to 2, and worrying about how this is going to impact their behavior and their bonding. Like Jessica said, with her son that never saw, a face without a mask for the first year. I feel like that's detrimental to a child's development. So I found that interesting that she said that.
Yeah, absolutely. Yeah, the thing that hit me, so as a lactation consultant, right? When you're talking about the parents whose babies are in the NICU and, they're just like pulling down their mask just a little bit, is that we talk about how, mothers kiss their babies. Like that's like a huge thing, right? And how that impacts the microbiome and the milk and everything else. And that's, it could really not be happening a lot. And what is that? Yeah, that just really hit me. Thank you for sharing all of that. I think that's all super relatable to, what we've been through, especially the challenges of online school. I'm right there with you. We also had to do some changes. And yeah, wow, how interesting that, and that you're still not able to see your clients in person. That's really challenging.
Yeah, wow. Definitely. Yeah. Thank you for letting me share. I do worry about my families they aren't kissing their babies. That's not even a thing. And they're so worried to pass it on that they aren't even doing, normal bonding behaviors. So
absolutely. Well, thank you, Sarah, for sharing your experience.
Thank you, Jenny.
So now we'll hear from Anna Arbel. Anna has worked with young children and families for many years in different cities and countries, with a degree in teaching from Argentina and an infant parent development degree from Bank Street College in New York City. She has supported both providers and families in programs like Head Start, Early Intervention, and the Birth to 5 Helpline. Anna has provided learning opportunities to professionals teaching at the Harris Early Childhood Mental Health Training Program and in conferences both nationally and internationally. She is currently the Birth to 5 Helpline Senior Program Manager at Southwest Human Development. Go ahead and unmute yourself, Anna, and share your experience with us.
Sure, thank you. Hi, everyone. Really happy to be here with all of you and able to share what was the experience for us at the Birth to 5 Helpline during this last, really almost 2 years. All what you said, Jessica and Sarah, we have been hearing that because, people, families, parents, caregivers, professionals call the Birth to 5 Helpline. Our service mostly is on the phone. So we talk with people, long conversations as needed, and also do home visits for families that have babies in the first year of life. That part stopped, came back, stopped, came back as things change and decisions were made in our organization. But overall, the big chunk of our work is listening to what the caller is saying, trying to be present to hear their story. And many of the things that both Jessica and Sarah were describing are things that we were hearing from moms, from dads, from grandparents, from caregivers in general, from people from childcare professionals, teachers from childcare centers, about all the difficulties, how it felt to them, and the worries they had about their kids. One of the things it's kind of at the core of what we do and how we do our work is thinking about, Dr. Brazelton, famous pediatrician, talking for many, many years about 2 basic anxieties. Parents thinking, is my baby okay? And will my baby be okay? And parents and caregivers thinking, I am okay as a parent, or will I be okay as a parent? And during COVID, this stress and this anxiety really multiplied in so many levels, absolutely from everyone. including us professionals working to support families. So much anxiety and stress that we hear from many families. They don't want to take the kids to the doctors. So many visits, even regular visits, were missed because who knows, is that safe? Will we be safe there? Many other programs supporting families, many home visitation programs, everything was like this, in little squares, through Zoom. So it takes so much to do this work in a different way that we all had to learn about how to work differently in these times. So the basic core of what we do is being present and listening to understand the experience of the other really was very, very important to rethink what this means for all the challenges that families have when little kids were not seeing other kids. That brought kind of what Jessica was saying, the challenges for so many kids starting childcare, stopping childcare, starting childcare, not childcare, and how families can support them. So as a couple of things that I want to share very fast is one thing that we started doing is asking everyone, how is this for you? Supporting a parent supporting a child during the pandemic. So making sure that the parent is okay. So a lot of what we had to do actually was looking for referrals for parents as well as for kids. Where can we do that? And one of the things that we discovered is that because we've all been trying to adapt and adjust, is that many, many programs that before had very clear zip codes, what families can we serve? Now started thinking, well, we should do the work differently too. So open up to families all over the state and sometimes nationally. So we had to be very creative in finding those supports that were so needed for everyone. So in order to support a little kid, the parent has to be okay. So those conversations had to happen first to then allow them to think what the child needed and how to work through all the challenges, how to help that child maybe start again in childcare. How are they talking about what is happening? Why do we wear masks? Masks are like wearing a shirt now, right? That's the new normal. How do we talk about this, even with very little kids? Because it's part of our life. So finding ways to make sense about this. And I have to say, just kind of something that came up for us as well is that it allows us to contact, because we live in these squares, many other professionals. And these kind of meetings are a beautiful example of it. Now we have new relationships with many other professionals that we haven't met before. I think it had helped us grow as professionals. And I think it's really important that everyone has an opportunity, either through reflective supervision or through meetings, even through Zoom with colleagues, to talk about these experiences, because it's been very hard for us as professionals too. And there is this thing that we talk about, compassion fatigue. It is very real. We feel it. And there's also vicarious trauma, because we had heard many, many experiences of loss and grief. Babies, children, and people in families' homes, and people in our own lives. So really important to consider all those parallels, right? We have with our clients a shared experience, which in a way, it's different from what it was before. So for us to consider that, we have something in common, but we are there to support them. So one of the things that through our theoretical approach to the work, we always consider is just before we start a conversation or a home visit, just think and reflect, take a mindful moment. How am I doing? Am I okay? Can I do this? And at the end of that interaction, do the same. Take, even if it's a minute, sometimes it's all what I need to consider. How was it for me? What kind of things brought up for me? Where am I now? Can I do what is the next thing that I need to do? Or what can I use to help me do the next thing that I had to do? So I can really be present for the next conversation or home visit or whatever it is in the work that we have to do.
Oh, thank you, Anna. That's really, yeah, that's really helpful and insightful. I think, especially from our perspective of fourth trimester, right? Like that's actually a lot of what we do is talking about caring for yourself so that you can care for your baby, right? I mean, and it's the same thing for caregivers. But I hadn't thought. So as you're talking, I was thinking about, do I do that with myself when I know my child has a problem, right? Like I was very concerned my youngest was depressed for a while. And I don't know if I took the time to say, Jenny, are you okay? Before you like go and address this problem, right? Yeah, wow. And so much of what we're going through right now is worry, right? Like grief and then worry, like what is going to happen? Like, how is that going to go? So that's a wonderful, invitation to us to just take a moment and say, am I okay before we start? And am I okay after? Because yeah, oftentimes we're not, I'm not. Thank you. Thank you so much for that. So we have time for a couple of questions if anyone wants to pop out and ask one. I'll give you just a minute if you want to pop them into the chat, but I was going to just pose a little small question. We have a couple minutes, so to our speakers, is there anything that you're doing right now, kind of in lines of what Anna was saying, to kind of mitigate the issues that you're seeing, or something you can think of that maybe as a state we could start to think about doing? And this is something that I think we can talk more about in breakouts. But just for our speakers, is there anything you're doing or you can think of or you've seen other people doing that might help, even if it's just on a tiny level, with what we're seeing?
Oh, sorry.
Go ahead, Anna.
No, what I was saying is thinking. There is a lot when we are listening to ourselves and to others, just validating that experience, and not trying as professionals to be the perfect professional. What the heck is that anyhow, right? Just to be who we are and bring that. As same as for a parent, right? There is not such thing as a perfect parent. And we're going to miss the mark so many times. But if we have the time to just reflect on that just a little bit, it's an opportunity to do differently next time. Mm-hmm. And that gives us room to grow. It does to our kids, right? So recognizing, sorry, I made a mistake. I'll do better next time. We'll do different next time. So that, I think, is really valuable for kids, even really young kids, for parents, and for us as professionals.
Mm-hmm. Absolutely. Thank you. And Jessica, were you going to say something?
Yeah, I was going to say one thing for me, kind of on the personal and professional level, I noticed through the pandemic, there wasn't a lot of help available. People weren't available. In person just wasn't an option. So now, as time has kind of gone by, I've always had a hard time asking for help, but then I've realized after working from home for so many months and then also being a full-time mom at home, like I just needed some extra help. So it took me a while to come to that realization and then the ability to ask for help. So now I am getting like a little bit of help with my kids here and there, and it's really made a big difference on like my mental health and my sanity, and probably everyone in my house's sanity, just to be able to have, you know, that little extra help, which can go a long way in terms of what it was to what it is now.
Absolutely. I totally agree with you. I know exactly what you're talking about. Yes. Having someone else to help makes a huge difference. Yeah. And I hope that the pandemic helped us learn to ask a little bit more. Yeah, that's wonderful. Thank you. So thank you all for the thoughtful discussion we've had so far. It's now time to shift to breakout sessions for a little bit deeper discussion. Jeremy, if you wouldn't mind opening up the breakout rooms.
They're open. I think people will automatically be placed in them. So you ready for that?
Yep.
All right.
Yep.
Well, maybe